Hello, back to Prepared Now. My name's John, and I'm a paramedic, and I'm going to explain to you some of the more of the things that come in this kit. Now, we've kind of gone over the Band-Aids and the wound care. Basically, I am going to make a whole episode on just how to do wound care. It's just very intensive because you could have a little cut, you could have a big cut, you could have arterial cut. It needs its own good 10 minutes just to break the ice. Next thing would say you rolled your ankle. That happens out in the woods, and the biggest thing is we need to figure out is what possibly if you broke something, or is it just a sprain. Honestly, the biggest thing, the way to determine that thing is most of the time, again, this is most of the time, I'm not your doctor, nor am I there to be able to tell you exactly what's going on, but most of the time if it's a break, you can't even put any pressure on that thing before you're about to want to scream out at anything near you. If it's you just kind of roll, it might be tender when you touch it down, but you can't put pressure on it. Basically, you know, we always expect it possibly to be a break, especially if it gets if it's not looking correctly. So if your arm or something is in a wrong direction, your foot's now flipped, yeah, it's broken. But we'll just say you kind of twist your ankle, but you can still walk on it. You're like, okay, it's good. And, well, they have stuff in here to help you with that. So these two items that we usually think of wound care can help you on a nice little sprain. So what I would suggest, again, I'm not your physician, but in a first aid situation where there is no medical help out there, I would go ahead and support that ankle. Now, the best thing is to hopefully have wearing boots and nice big socks, but if not, I'd go ahead and look down at your ankle, see if anything's sticking out. There's no bone sticking out. We're definitely just dealing with probably a sprain, and if you could put pressure and you could still walk, it's moving towards that. Again, no one can determine if it's broken unless we have an x-ray machine. I doubt you have one of those in the back of your car. Anyways, so we're going to go ahead and make that ankle a little more comfortable so you can get your butt back out to society and or anywhere you can to do a little bit further medical care. We're going to go ahead and take off the sock. We're going to clean the area. Always like to have a cleaned area, no matter what. And we're going to use this rolled gauze as not as something to absorb something, but more as a kind of foam-like squishiness. It's a cushion. So you're going to go ahead and just wrap it around. Trust me, it doesn't matter how long you've done this. It's never pretty. As long as it works, it works. So you're going to wrap it in circles, and then you're going to use the tape right here to stop it, or you can use those lovely these. I would suggest not to because they might poke into your skin, but to each his own. I'd use tape, and then our lovely elastic bandage. Most people know them as Ace bandages. Basically, it has kind of like a rubber, latex, whatever in there that keeps it stretchy. That keeps the pressure on it, and we're going to use that in the same fashion. So we're going to go over this with this, which is your Ace wrap that everybody calls. Now, the biggest thing is we kind of go in a X motion. So you go up and over, up and over, up and over, kind of circling the area. You can go around, it's not going to hurt anything. And honestly, the more times you play with this, and you know, if you have some kids at home or whatnot, this is the time you get to play mummy with your kids. You sit them down and act like they get a bummed up foot, and you practice with this. This stuff can be replaced real easy. And this is the time when you learn how to use first aid. It's not when you want to learn when you're out there. You just got done with this lovely hike. It's getting dark, and you stick your foot in a crevice and you fall down. After you've done some nice, lovely words I'm not going to say on YouTube, and you're pleading to some kind of God, that's not the time to be trying to learn how to use first aid supplies. But forget my rant. The next thing you want to use is this lovely athletic tape. It comes with an athletic name because it's used a lot in athletics. This tape, again, as we discussed first, is extremely sticky. which is great in the outdoors, because you're already probably sweating. You're already probably, you know, feeling kind of all kinds of sticky. So it actually will stick to things. Now, think of this as a firm substance, so you can wrap this on top of your Ace bandage to give, in certain areas, a little extra from keeping it from expanding. So if you have one area that's really feeling weak and you want to get some nice hold to it and compression, this is what you do. You just wrap that area with a kind of firm motion, not tight. Do not do it tight, because what you end up is your foot's going to go numb, and you're going to have to take this off because it's going to hurt. And then worse, you might lose blood flow to that area. Big no-no. So what we're going to do is just do a light pressure to that area with this tape. Now you can go crazy on the tape. I suggest a couple wraps on the worst areas, because you're going to want to monitor this and make sure that area is not getting totally swollen, and it's going to swell as time progresses. You just had the injury. Unless you have a cooler of ice, that's great, that put ice on it, but if you're out in the woods, you're going to need to just support it so you can get back to somewhere that you can further do better care. And this is just going to help you feel better. Also support that ankle when you're climbing out of whatever hole you got yourself into, back to the campsite or car, so you can get back to the emergency room. Either ways, these things are going to be essential to help. Now, what they lovely have put in here, and some people do forget, because we usually have this laying around, I would take some over-the-counter painkillers. Now, the two ones, depending, you can talk to your doctor before you take any kind of medication, of course. This is just for general public use and not for specifically to any person. But ibuprofen and Tylenol are excellent for over-the-counter pain relief and inflammation use. Ibuprofen is more for inflammation. It helps cause that, you know, the inflammation was causing pain and that swelling. That's going to help with that. There's instructions on how much you need to take on the package. And Tylenol, if you haven't seen Tylenol, you've been living in a hole. So both of these are excellent to take on top of your sprained ankle and help you get your butt back to your car and back to civilization. Again, this is Prepare Now, and please hit that subscribe button if you want to continue to see these updates about how to use first aid gear before it's going to be really needed.